I mean, honestly, the advancement of immune therapy in colorectal cancer was a highlight of this year's meeting. The Atomic clinical trials, the first prospective study to look at adjuvant immune therapy in combination with chemotherapy for patients who have MSI-High stage 3 colon cancer, finally giving us data to use our better drugs in the adjuvant setting, showing improved outcomes in that patient population and higher chances of cure. Additionally, we got updates from CheckMate AHW demonstrating significant improvements in outcomes in patients with first-line nivolumab and ipilimumab, that MSI-high colorectal cancer compared to chemotherapy. And that benefit even persisted beyond the first-line setting, even in the second-line setting, again demonstrating the importance of using our better therapeutics in earlier line settings. And kind of along that thread, the BREAKWATER clinical trial was updated to present progression-free survival, which showed, again, significant improvement in outcomes in patients who had BRAF V600E metastatic colorectal cancer. And the experimental arm included FOLFOX in combination with targeted therapy with encorafenib and cetuximab versus FOLFOX alone. Again, continuing that trend of using our better therapeutics in the earlier lines leads to better outcomes. I think what we've really learned, again, kind of highlighting what I just said, it's really, we're seeing the benefit of using our targeted and immune therapies when a patient's a candidate in earlier line settings. And I really do think the, smaller abstracts are showing future directions of increased targeted options, increasing our immune therapies, and studying those in earlier settings. So instead of waiting for third line, fourth line, really enrolling patients that are in the first or second line where they still have a good performance status, still have a good immune system, where we can see the maximum benefit of these therapeutics. So we did get updates from the Dynamic 3 trial, which took patients who had stage 3 colon cancer and were ctDNA positive after undergoing resection, clearly, again, showing the prognostic importance of checking ctDNA in the postoperative settings, again, showing the poor outcomes these patients have after a curative intent therapy. So we know this is a really, really high-risk population. At the end of the day, the data still doesn't really show that intensification of therapy is salvaging these patients, which kind of makes sense. If your DNA is positive, you get chemotherapy, and you still remain positive, we're not seeing improve outcomes by adding more chemotherapy. So this is just an unmet need in patients where we need to figure out what's the right therapeutic for these folks. A majority of our patients, unfortunately, do not have microsatellite unstable or deficient MMR proteins in their disease and will not have the same response to immune therapy compared to patients who do have those findings in those tumors. We're largely stuck with chemotherapy for those patients, and though we've seen great advances in targeted therapy, that's still representing a very small portion of patients. We really need to understand what is the right combination of immune therapies to either whether we add that to chemotherapy or by itself to improve long-term outcomes for that patient group, which is honestly majority of our metastatic colorectal cancer patients. Honestly, I'm actually really excited about seeing how these new therapeutics do in the adjuvant setting. So now we have Atomic showing the immune therapy is important in the curative intent setting. But now that we have a BREAKWATER shown us we have better systemic therapy for BRAF-mutant colorectal cancer, there is an ongoing adjuvant trial looking at adding encorafenib and cetuximab to chemotherapy. I think that's going to be exciting to look at. There are several new immune therapy combinations coming down the pipeline showing early activity in metastatic colorectal cancer, even if patients are proficient in MMR or have microsatellite stable disease. And it's just exciting to see the field move forward in that direction.